Morning all, and welcome to the February 28th meeting of the Citizen Oversight Board. We have an exciting agenda today and are joined by Sheriff Elias Diggins. Thank you, Sheriff, for joining us. What I have a couple of announcements shifting there. First is the mayor's office is still working to fill 2 seats on the board. I feel like I've said this for many months, and so hopefully that changes in the short term. But if you know of somebody who would be a good fit, please encourage them to apply. Next, the Office of the Independent Monitor is hiring for a deputy monitor position. Application closes next week. So if you know a lawyer who would be interested in doing oversight work, let them know right away. And Greg, is a lawyer a requirement or a nice to have, not a requirement? Okay, so somebody who might be a lawyer in their aspirations, but not based on their JD also could apply. Or somebody who's got experience in oversight or investigations would be great as well. Okay, excellent. Next, folks have had a chance to look at the minutes from February 14th. If I could have a motion to approve those minutes.
I think we might have to wait on that. Larry just apparently got dropped.
Oh.
So he'll be back in a moment, but
Okay.
we might have to wait on that.
All right, good. So let's move to our conversation with the sheriff. Sheriff, thanks again for joining us today. I know we sent a couple of questions in advance of the meeting, but before we get into those, I wanted to say a few things. First, we've been made aware of the dashboard that y'all have published regarding the Denver Health related data, and just wanted to say thank you for your collaboration and partnership on that. We've been having conversations about our desires there for a few years, and so it's awesome to see that come to fruition, and we look forward to engaging with you on that data today. Next, I wanted to ask you maybe to cover, I know there was a death in custody, at least one this week and maybe another earlier in the week, but if there's anything you want to say about those 2 incidents, perhaps we could start there, and I'll move it over to you.
All right, thank you, Madam Chair, and good morning, board. And
morning,
Greg as well. It's always a pleasure to be able to meet with you all and to answer the questions that you have. I'd like to start by first recognizing and praising the work of the men and women of the Denver Sheriff's Department, who every single day show up as heroes in the community, sometimes unseen, often unsung, but I can tell you that they are dedicated public servants who love the work that we do, and we appreciate the community's support as well. I'll begin by addressing the 2 deaths that occurred, one on February 8th of 2025, the other on February 25th of 2025, and we send our heartfelt condolences to the families of both of those people who were in our custody when they unfortunately passed away. On February 8th, it was a male who was in our custody that was discovered non-responsive in a housing unit. A medical emergency team was immediately called and performed life-saving efforts, and shortly after, he was deceased. And for any protocol with any death investigation, the Denver Police Department is conducting an investigation, and our Public Integrity Division will review the actions of our staff, and Denver Health conducts a review of the medical response as well to ensure that that investigation is not compromised. I'm limited in what information I can share. The identity of the person, their cause of death, notification of death to the family, and the like is done by the medical examiner. It's the same circumstances for the young lady who passed away in our custody on February 25th at approximately 4:30 p.m. at the downtown detention center. She was discovered non-responsive in a housing unit. A medical emergency team was immediately called to perform life-saving measures. She was shortly after pronounced deceased. It's the same process as the first incident where the police department is conducting an investigation. Our public integrity division is doing a review, as is the Denver health team for their medical response as well. So I will pause and stand for any additional questions with the caveat that I'm very limited in what I can say.
Questions from the board on this topic? Go ahead, Rufina.
I'm sorry, I may have missed this, Sheriff Diggins. What was the cause of death of the February 8th incident?
That is still to be determined, ma'am. We're waiting for the autopsy to be completed by the medical examiner, who will determine the cause of death in both of those incidents. Let me also say these are extremely hard events for our staff to go through as well. When they happen, our senior leadership team, executive leadership team, and myself, along with our mental health team, respond to check in on our staff and just help them along during these incidents. We also roll out our crisis response team and mental health providers to check on the people that are in custody to ensure that if they have needs, that those are addressed as well.
Thank you.
Okay, thanks. And we will look for more information on that in the future. Next, a very hot topic these days is immigration, particularly in Denver. Can you talk a little bit about the Sheriff's Department's interaction with Immigration and Customs Enforcement? I've heard a lot of different interpretations of when and how you interact, and perhaps you could provide some clarity on that, especially for our community members.
I can, Madam Chair, and there's actually a question, and if you are okay with that, I'll just go through the questions and answer them as they were presented to me. I see that Rufina presented a question in the chat. Are these the first deaths in the jail this year? Those two are the first deaths for 2025, Rufina. So the first question is, can you share the extent to which the DSD interacts and works with Immigration and Customs Enforcement? I'm sorry, was there a follow-up to that? Okay. Can you share the extent to which the DSD interacts and works with Immigration and Customs Enforcement? The Denver Sheriff Department does not honor detainer requests from ICE, which are not criminal warrants issued by a judge. So our interaction is pursuant to the Public Safety Enforcement Priorities Act, which was implemented by Denver City Council in 2017. And when we receive a request for notification for ICE, that form is known as an I-247 in the Immigration and Naturalization Act. The individual in custody is advised of their rights upon receipt of that request, and prior to their release, we will email ICE notifying them that the person who they're wanting the notification for has been moved into the release process at least 2 hours prior to them being released from our custody. It is the responsibility of ICE to arrive at our facility prior to release. And once that person is no longer in our custody, ICE can take them into their custody. I'll pause there for questions. Madam Chair, you're still on mute.
Do neighboring jurisdictions have similar policies, or how common is your approach?
Thank you, Madam Chair. And that's the second part of that question. It varies from jurisdiction to jurisdiction. There's been a lot of conversation about how sheriffs do this. Some sheriffs may replicate the process that we have. Some may have a more robust relationship with ICE, it is dependent on the sheriff of that jurisdiction. Karen?
Good morning, Sheriff.
Good morning, ma'am.
Does your process include, or does it relate to the person being given to ICE once they're released, or if, for example, are the agents of ICE allowed to come into the facility where the individual is being released?
That's a very good question, Karen. They are not allowed to come into our facility. So once the person is released out of our custody and in the public space outside of the jail, ICE has the ability to take them into custody once they're no longer in the jail. We've also asked them not to take that person into custody in our lobby, because technically that's a public space, but we've asked them not to do that in our lobby as well. I believe I see a hand from Rufina.
So at this point, since the Trump administration took office, can you tell me how many of your, how many of these kinds of detainees have now been, you've notified ICE, and I don't know that you would know whether they've been taken in by ICE, but at least how many have you notified ICE about?
We do not know how many ICE may have taken into custody after they've been released, because we do not track that. If you'll give me just a moment, I can tell you the number of requests that we've received in 2025 since January 20th. Okay, up until, and the last time that I did a count in the first quarter, well, let's say January until February 21st, we have received 35 requests for notification. That number does not include this past week.
Is that like a typical amount? Is that more or less? Is that different than 2 years ago?
It varies.
Okay.
Since the Secure Priorities Act was put into place in 2017, the fourth quarter of 2017, we have received 1,226 requests. And so it ebbs and flows each quarter. I can tell you that during COVID, that number dipped significantly to single digits in the quarters. There are some where, let's see, the highest quarter for us was 2018. We received 108 requests. And the second quarter of 2019, we received 105 requests. As I said, during COVID, the third quarter of 2021, we received 1 request. In 2024, I can tell you each quarter what those numbers are. The first quarter, 8 requests. Second quarter, 26 requests. Third quarter, 2024, 18 requests. And fourth quarter, 32 requests.
Okay, so it seems pretty variable quarter to quarter.
Correct.
Do you know what drives the requests? Right now, what appears to be, at least in the public arena, is that we have ICE under a quota system. Have you noted any difference since that got implemented?
I'm not sure what drives the number of requests that they send to us. We haven't seen any increased activity in or around our facility.
So they've been respecting your request that they not, first of all, come into the lobby or be around the jail. Am I accurate in that?
I don't know around the jail because we don't know what happens once the person is out of our custody. They have honored our request for them not to come in our lobby, but once the person leaves, there's no way for us to know if ICE has actually taken that person in.
Given the public show, shall we say, that they tend to be displaying about, their detaining and all of that, I think we might all see it. So we'll just have to see what happens now. Thank you, Sheriff.
You're welcome, ma'am.
Larry asked in the chat, are you getting a lot of push from ICE in regards to informing them of people in your custody who they do not have a warrant for, or push from them to screen folks for their immigration status?
We're not getting any push from them for notifications. We have continued with the same notification process that we've had since the ordinance was enacted. And let me read the second part of that question now.
Or push from them to screen folks, I assume, based on immigration status.
No, ma'am, we've had no conversation or additional push from ICE.
Okay. Stefan, I see your hand is up.
Yeah, I have a cold today, so sorry for the nasal voice. Sheriff, thank you. Can you explain a little bit more the basis for when ICE requests a notification, and is that based on just immigration status, or is it based on criminal conduct? I'm just a little unclear on that. Sorry.
It's based on the Immigration and Naturalization Act, which has several sections. They have an I-200 section, an I-205 section, which is a arrest warrant notification, and the form that we receive is referred to as a 247. So this is a detainer request that simply asks us to notify them once someone who's in our custody is going to be released that they may want to take into custody.
I see. And presumably they're making that request because the person is undocumented. Is that right? Yeah.
That's generally the case.
Yeah. Okay. Thanks, Sheriff.
Welcome.
Any more questions on the immigration topic?
Okay, I'll move on to the second question. Thank you for publishing a new dashboard with data from Denver Health. We really appreciate it. Part of the dashboard includes the outcomes of medical grievances. Can you tell us how that resolution process works and the degree of visibility you have into each case? First, we want to say thank you for the recommendation. It was our privilege to partner with you to stand up the dashboard. We know that as you all would like to see this information, the community does as well. I'd like to give a shout out to our jail medical administrator, Ronnie Brown, and the Denver Health team, to include their health services administrator, Carmen Casatley, and nurse manager, Carol Rogers, for working together to get this information, as well as our data team for actually standing up the dashboard. When a medical grievance is received by our grievance incident review team, a copy is provided to the jail medical administrator as well. The medical staff will then investigate and respond in writing to the grievance, and our jail medical administrator also receives a copy and reviews that response. If there's a question or concern about a response to the patient, the jail medical administrator will meet with the health services administrator or the nurse manager to discuss the response. Discussions or challenges to outcome determinations have resulted in chart reviews, review of medication administration records, documented clinical staff reeducation, change in the status of the grievance response, additional medical follow-up, or additional perspective provided to the jail medical administrator. It's rare that Denver Health initiates a notification of a more concerning grievance that's been identified, but the jail medical administrator does this routinely every day to ensure that the grievances are in line with our expectations. And Denver Health is receptive and has provided to us whatever we have requested or reviewed in that detail. I'll pause there for questions.
Perhaps you'll cover this in some of the sub questions, but I think for me, one of the most important things to understand is the interaction between the kind of grievance and the kind of medical care an individual is receiving. And why is that? If we've got problems in optometry, for example, or problems in pharmacy, for example, or, there are kind of repeated service quality issues in an area, getting that sort of alignment between where our grievances and where our services, I think would be an important next step on that dashboard. But I wonder if you have a sense of that information that's not published on the dashboard yet.
I do, Madam Chair. We actually use the grievances and the categories as a barometer for how medical services are occurring in our facilities. And if the jail medical administrator sees that there's a rise in a certain area, she'll bring that to my attention. She'll bring that to the health services administrators' attention. We also have a continuous quality improvement process where a larger group oversees that information that's presented from Denver Health. That includes their staff, some of the senior level medical folks, along with the majors, the division chiefs, and the jail medical administrator meet together to talk about the fluctuations in those services to ensure that they are as we should expect. And for the most part, I can tell you that when those are addressed, in fact, every time they are brought to the attention of Denver Health, they make it a priority to address internally as well. Okay.
And is that like a real-time process? Like, oh gosh, we got 7 grievances on optometry today. Or is it more of like each quarter you sort of look like, sort of talk about how the remediation of issues takes place?
It's both. One of the benefits of having the jail medical administrator is somebody who's dedicated to seeing those grievances and watching that barometer from week to week. It's also reviewed during that CQI process, which is done quarterly for that larger group. So Ronnie can talk about what the response was with that group when she saw those fluctuations. She also brings that information to me. And during the CQI process, it can be talked about procedurally between the medical staff and security staff as well. No additional questions. I'll move on to the second part of that question. When Denver Health sustains a medical grievance, do they inform you about any remedial or follow-up actions they take? When they sustain a grievance, they do meet with the jail medical administrator to discuss what happened so that she can dig into the issue to ensure that it is resolved, that there is no continuous problem, or that there isn't something else that needs to be done. The health services administrator and the nurse administrator also make it a priority to address whatever issue was sustained in the grievance. I'd also like to note that Denver Health Jail Services is accredited nationally as well. They're accredited by the National Commission on Correctional Healthcare, NCCHC, which sends to our jails every 3 years auditors, external auditors from across the nation to review their medical services, policies, and procedures to ensure that they're in line with national best practices. I can tell you that their grievances and their responses have been, they pass the expected practices of the NCCHC for grievance responses and review as well. I'll pause there for questions.
Do they provide services to any of the other metro area correctional facilities?
I believe there are a few other jails that are NCCHC certified. I believe Arapahoe County has been because.
Oh, I meant, is Denver Health providing those services?
No, they
Okay.
only provide medical services to the Denver Sheriff's Department.
Okay, great.
However, but Madam Chair, let me also clarify. There are sheriff's departments and the Colorado Department of Corrections does send people to the correctional care medical facility when their care is above and beyond that of infirmary care at the jails or the prisons. And so we do actually have them bring the people that are in the custody to Denver Health on 6th and Bound.
Okay, interesting. And that's like a locked down facility. Okay, interesting.
It's locked. It's in the basement of Denver Health. It's staffed by Denver Sheriff employees. We have deputies, sergeants, and a captain that is assigned there. And so they work closely with those other jurisdictions when they need to bring someone for care to that facility.
Great. And presumably if folks have medical care needs that are beyond the scope of the infirmaries that you have, they transfer there as well.
That's correct.
How often is that I know it's hard for you to estimate that, Sheriff, or give a given number, but is that used fairly extensively or not very often? I mean, can you ballpark it?
It depends. Are you referring to our need to utilize it or other jurisdictions?
Our need.
We have folks that are there every day, and we have about 12 beds that are there.
Okay, 12 beds.
Yes, and I'd be happy to take you all on a tour so you can see the complexity of the CCMF. In addition to that, if someone is in the regular hospital, we have deputy sheriffs that may be stationed there as well in the emergency room. The police department, unfortunately, has to have someone that they are bringing in that can't come to the jail and has to be in the emergency room. Denver deputy sheriffs would sit on that person. There may be other areas where someone has to go into surgery who's in custody in the hospital. Denver sheriff deputies would be in those areas of the hospital as well. So it's a very complex and very risky part of our operation as well. The folks that work there are some of the best members of our organization. They have to be on the ball every single day because it is a very high risk area.
I see. Okay. Thank you for that more detail.
Go ahead, Karen.
In instances where there is remedial action taken, is there a letter sent to the complaining citizen explaining the process, and who does that letter come from?
It comes from the health services administrator or the nurse manager explaining that they reviewed the grievance and that matter was sustained, and it does go back to the person.
Thank you.
Mm-hmm. Okay, I'll move on to the next. I'm sorry, Rufina.
In the instance where there is a prisoner, a detainee who may, for whatever reason, medical reasons or others, that they can't advocate for themselves, can the family participate in this, and thus you're allowing others to participate in their medical treatment? I don't know how that would work in the jail instance.
Yeah, the nurse manager or the health services administrator would attempt to work with the family or the family's attorney. Whoever has power of attorney would be contacted for those medical decisions.
Have you had many of those instances?
We have. They're few and far between, but we have had those, and Denver Health works directly with the family to facilitate that conversation.
Okay, thank you.
Mm-hmm. I'll move on to the next part of that question. Do you know why unfounded outcomes went from 16% in 2023 to nearly 70% in 2024? We do. And I'll tell you, we appreciate that you brought that specific data point to our attention. It was actually an error on our dashboard, which is being rectified. The error was 1/4, so 16% represented 1/4 in 2023, and the entire data for 2024 was reflected. There were a total of 1,064 grievances in 2023. 82.9% were unfounded, and 1,345 grievances in 2024, 69.8%, which were unfounded. So an unfounded grievance means that the complaint was not based on credible facts as shown by the investigation, or the alleged violation / action did not occur. And so our team is working on getting that rectified, and the dashboard should be back up today. I'll pause for questions. Yep, I'll move on, Madam Chair. Over the course of 2024, it appears that the time it takes to see a doctor, pardon me for just a moment. It appears that the time it takes to see a doctor for routine care doubled at both DDC and county jail. Can you speak to why that metric changed so much over the year? Fluctuations in clinic time can be impacted by staff PTO. We have doctors on staff, and some of them take time off. And there's also been turnover and increase in jail population and the level of care between the DDC and the Denver County Jail, which can impact those times for folks to see doctors. However, what I will tell you is that those folks still have access to the nurses. They still have access to additional medical care from the folks that work with Denver Health. We do not believe that any patient outcomes were impacted by any additional wait time, and we did not receive any grievances, which indicated that as well. I'll pause for any additional questions.
So the access to care is still there, but what's the difference in the data? I guess I'm missing this sort of explanation there. Is that there are less folks, so you still get there, it takes more time? What can you say more specifically about that?
Sure, staffing changes with the doctor. So although we have nurses and other medical providers that go and see the folks that are in our custody, PAs, we have doctors as well. That's the highest level of care that we have. And those doctors sometimes take more PTO. One of them has moved into a part-time status with Denver Health. And so some of those times may have been impacted to see the doctors. However, there was no time where a person was not able to talk to a nurse, licensed practical nurse, or the like.
Okay. Yeah, so maybe some reporting on that would help improve the look there.
Thank you. We appreciate that recommendation.
All right. Okay, great. Thanks.
Okay. All right, I'll move on to the next question. How many times was the contact visitation facility utilized over the course of 2024? After opening on May 24th, 2024, there were 34 visits which were completed in 2024. I actually replaced the original captain who we had assigned to that post, who did a great job standing it up, but I wanted to make the program more robust, so I reassigned a new captain to contact visits at the county jail. And since that time, in 2025, we have already completed 26 visits to date. So we're looking forward to additional utilization of the program. I have another project that we're working behind the scenes to implement, which we believe is going to be very exciting. I don't want to reveal that just yet. You'll have to wait. Hopefully by the next time I meet with you next quarter, I'll be able to announce what that is. But as we have this beautiful contact visit space, we want to take our contact visits to the next level, knowing how it impacts not just the person in custody, but also that experience impacts the people who they love, especially the children that are coming into our facility. I'll pause for questions, Madam Chair.
Just great to hear that those numbers are coming up. I think what we saw for last year felt a little lackluster for all the investment made. Obviously better than zero, but this year seems like a much better use of that space, and excited to hear. We'll hold our breath as to what's next.
Yeah, we had some things that we had to work out. This is the first time that we had done in-person visitation, contact visitation since 2005, and there aren't jails across America that are doing this, except for in Las Colinas, which is in San Diego, and a handful of other jails. But we're the only jail in Colorado, our jail, that's bringing that back. So it's very exciting for us to get this program stood up and to be able to utilize it to its full potential.
That's great. And so just to sort of like clarify for folks who might not be familiar with the contact center, folks might be in your custody for many months, years, either serving their time or in transition to other facilities or awaiting trial or things like that. And so the goal of the visitation center is to better connect families in particular during that time. Is that a fair assessment?
That's exactly right. 97% of the people that are incarcerated are coming back to the community. We know how important those familial connections are for a person's success once they leave our custody. So being able to hug a loved one, to touch a loved one, to meet in person with your child is something that there are no words for the human touch. And so we'll still continue to offer video visits, which that's the method that is utilized the most by the people that are in our custody. But the addition of the contact visits at the county jail, we believe, has been a success for our organization, for the people in our custody and the community as well.
That's great. Have you had, Rufina, go ahead.
I had a question about how you will assess success. Is there surveys, or is there just sort of discussions amongst yourselves? How are we going to make that success goal actually happen?
I think the number of people that are utilizing the program is, to us, an indicator that it's a success, especially if we have folks that have repeat visits while they're in our custody. For us, that's a success, and knowing that on the back end, when people leave our facility, that they're able to have that connection with their family as well. And we certainly could check into recidivism rates to see how it's impacting recidivism for some of those folks that have visits too.
And just remarking about the fact that, you know, you get surveys for almost, well, that may be over stating it to say everything that we do, but certainly, you know, I get a survey if I've contacted a service provider, vendor, and how did we do? You know, some bathrooms, you know, you click on the thing to tell you whether or not you had a good experience in the airport or something. Won't go into more details. Anyway, bottom line is they're trying to get in time feedback, right, about how their service is being experienced. So I'm just wondering if we could take a note from that and do something similar, not anything extensive, because you don't, you know, this is not for research purposes, but certainly for getting any kind of, there seems to be a pattern here about a problem or an issue.
You know, that's a great recommendation. I, in fact, will have the captain that's overseeing the program take that on as one of the things that we can do for the families on the back end, and perhaps even for the people that are in custody. So thank you for that recommendation.
I appreciate that. I also know that when you ask for information, you get it. And so, having to be prepared for some sort of response is obviously needing to happen. So, I don't want to add more burdens to the staff, but I think it is valuable to get that kind of information.
Yeah, I appreciate that. We certainly would utilize it to improve the customer experience on both sides.
Thank you.
Stephanie?
Sheriff, to what do you attribute the increased usage of the in-person visit opportunities? Do you think it's largely due to visibility? Because obviously that you're right, this is a new thing. Yeah, you said you haven't done it since 2005, so maybe a lot of folks didn't know about it. But are there other factors other than increased visibility that you attribute to the increase in the first quarter this year?
Thank you for that question, Stephen. I attribute it to the change in leadership. One of the benefits of being in this organization for the past 31 years is I know the skills and talents of the leaders throughout our organization. And I think when you put the right people, the right leader in the right place, that you can have different outcomes. So I think it was the change in leadership. But I still want to give just due to the leader that was previously in place that helped to stand the program up. He did a good job about taking it as far as he did. We changed leadership, and we now have another captain who's taking it to the next level.
Got it. Thanks, Sheriff.
All right, I'll move on to the next question. I believe it is the last question on the list. How many suspected overdoses / naloxone administrations were there in the jails in December and January? As I've shared before, we do not characterize incidents as overdoses in our facilities because to do so will require a toxicology exam on people following medical events. We do, however, deploy naloxone, otherwise known as Narcan, in episodes where medical intervention is required for people in custody who appear to have perhaps ingested narcotics or may be unconscious and in medical distress. In December of 2025, we had 3 instances of naloxone administration. In January of 2025, we had 5 administrations of naloxone by our medical staff or by uniform staff as well. I'll pause there for questions.
The number was 325, you said?
No, ma'am. 3 in December and 5 in January.
Okay. I was like, wow, that's a lot.
That would be a huge spike.
That'd be
like
an
10
issue.
a day.
Yeah, right.
3 and 5. Great. Thank you. Glad I asked. Okay.
And that's coming down. That's significantly lower than it was early in 2024.
Yeah, the peak we had in May of 2024 was 14, which was every other day or every other night. And more so every other night, myself and Liz Castle were on the phone all the time, being woken up at night. And that's when we began to take proactive steps to implement our task force that she and her team are a part of that has been attempting to combat this. Let me just also share with you, this is something that jails and prisons across America are dealing with like never before. It's the second hottest topic of discussion at our conferences. The first is still staffing. The second is the fentanyl invasion of America. Unfortunately, has rolled into our facilities, and it is a full-time job, more than a full-time job, trying to combat that. So we're going to keep at it to try to help to save lives. I'll pause there for questions.
Do you have a sense of what specifically, which of the measures have been sort of most successful, or is it the combination of measures?
I think it's a combination. I think the introduction of our body scanners has helped tremendously. We have canines who had to be retrained or have additional training for fentanyl. They were already able to detect marijuana, cocaine, meth, and so we had to add fentanyl to their training. We have an emergency response unit team which does searches. We have a partnership with the Denver Police Department who does some things with their narcotics team to prevent things from coming in or to investigate things on the back end. Sometimes we involve national partners. There's a lot that we've thrown at this problem. And so I think all of it collectively will help us to continue to do so. Alfredo, I see you have a question.
I do, Sheriff. First of all, again, thank you for the dedication and commitment that it takes to running the prison system. I can't imagine what y'all see on a day-to-day. So thank you for that. I was a little late to the call, so apologies if y'all addressed this at all. But I'm wondering if you could speak to the recent decision to shut down the National Law Enforcement Accountability Database, and if that's having any kind of repercussions locally.
We haven't been impacted by that. I'm not sure. I'd have to go back. I heard about it, but I don't believe that it has impacted the DSD.
Yeah, if you could follow up on that, on any kind of unintended consequences or any issues that may arise locally in how that's tracked and reported, and ensuring that there's still some kind of way to track that.
Yeah, Alfredo, if you will help me, I believe that's the database whereby if a police officer or a sheriff is working, let's say in Georgia, and they apply in Denver, if they were fired from a facility in Georgia, it would track them and let us know that. Is that the database that you're talking about?
Yeah, I believe so.
Okay. Yeah, we have a very robust background and investigation process. And in fact, when someone applies to be a member of our organization, they have to sign releases for any and all information relative to their previous employment, to include internal investigations. So we would know whether or not someone had a instance, let's say, of a bad use of force, or they were terminated for some reason from another jurisdiction. We would learn that in the background process. And I can tell you those aren't the folks that we want as members of our organization.
Can you say, so like Virginia, for example, has a prohibition on sharing police conduct records. So in that case, the employee is allowing for the transmission of their own records. And so you were able to get those.
Yeah, that law may exist in Virginia, but we asked them to sign a release. And if they refuse to sign a release, for us, that's a red flag.
Yeah, no doubt. What are you trying to hide? Can I ask a question that's not here? Do you receive federal funding, and how sizable is that amount, and what conversations are you having about potential impacts to cost reduction measures in the Fed?
Citywide, we're having the conversation for the Denver Sheriff's Department. Our phenomenal Department of Finance is gauging how any loss of funds would impact us, because we do receive federal funds directly from JAG burn grants and the like, as well as pass-through funds that may go to the state, and then the state distributes them. So at this time, we're working with our finance team and the larger budget and management office for the city to see if there's any adjustment that will need to be made if there was a loss of focus.
Okay, thanks. And then a follow-up question to that is, I might make an unfair assumption that many individuals in your custody are eligible or receiving Medicaid. And so do you charge their Medicaid for health services rendered, or is that something else?
There's actually a national conversation about the medical exclusion for people that are in custody, which we being myself and other sheriffs across the nation, have been attempting to change, because when someone comes into our custody, their benefits get turned off, and it's such an arduous process to get them turned back on.
Okay.
So there may be times where someone is in our custody and Denver Health is able to backbill for Medicaid charges, but the majority of the time when someone is incarcerated, those benefits get turned off.
And then if a person is leaving your custody, do you in any way administer like SNAP benefits or anything like that as a first sort of step for folks?
Yeah, we actually have a partnership, which I can share. Anne Marie Braga, who is the director of Denver Human Services, a great partner for us, and I work together to actually re-implement something that had been stopped during COVID, which is she has assigned 2 personnel to the jail to actually enroll folks in services to include SNAP and other benefits that they may be eligible for once they leave our custody. And so I just received the email from her this week. I believe those folks are going to start next week with standing that process back up.
Great. Hopefully those benefits are there for folks to receive them.
Yeah, it's one of the things that is needed, right? When folks leave our custody, first thing they need is hope. Second thing they need is a place to stay. The third is they need to be able to sustain themselves. So those benefits help them, housing helps them, healthcare helps them. And so the more that we can provide that for them before they leave, the easier it is for them, because as soon as they get home, they may have to go back to helping the kids get to school every morning or going to work, and it becomes, like for the rest of us, a challenge. And so we want to help them to be on their feet and to leave us better than how they got here, and to have those things in place.
Great. Other questions from the board?
Sheriff, are you aware that any federal funding has been withheld from the city to date?
I personally have not, but I would pose that question to Nicole Doheny, who is the chief financial officer for the city. But I have not been made aware of anything.
Okay.
Okay. Go ahead, Rufina.
So there's different initiatives that are happening right now in the federal level that may impact the jails. One is the fact that they're talking about no federal funds for DEI efforts, for work that's being done with transgender individuals. I'm just wondering whether your leadership team is, trying to anticipate any of these kinds of changes and your response to them. And I recognize that it's still in flux, so it's not a whole lot of information currently, but it appears that there's definitely direction in that mode. So I'm just wondering what kind of conversations your team and you are having.
Thank you for that question, Rufina. Let me start by saying the Denver Sheriff Department is the most diverse law enforcement agency, not just in the state of Colorado, but probably in a 5-state region. We know that our diversity makes us stronger. We are committed to ensuring that all people who either work with us or come into our custody understand that we value that. We absolutely do. That includes the folks that have had a newfound, I don't know the word that I want to use. We also value the folks that are in our transgender community, along with the diversity in our agency from race and gender, ethnicity. We accept all people in our agency and value their experience and protect them. In fact, the Denver Sheriff's Department's policy on people coming into custody who are transgender is a national model that was adopted by the National Institute of Corrections. All of that to say that the current national conversation about undoing all of the wonderful work is in flux, and we'll wait to see. I know that the mayor supports equity and the Office of Equity in the city of Denver, led by Dr. Ben Sanders, has been doing a lot to educate all of the executive directors across the city. I support his work. We support his work, and hopefully we'll continue to be able to make progress when it comes to valuing all people, regardless of who they are.
Just like Julia said, the federal funds are now being used as a stick, if you will, to punish cities, states, other kinds of entities, nonprofits, et cetera, for possibly continuing their work in DEI and also protecting civil rights of underserved groups. So it's a conversation that I know is really difficult right now, but I don't, let's put it this way, I think it's coming in our direction. So having those conversations and trying to figure out what we're going to do when and if federal funds are removed, and what other kinds of punitive measures are taken.
That's a very interesting time. And I think
Yes.
those of us in leadership have to take a stand to ensure that people know that we stand with them and we stand for them. And sometimes we'll even stand in front of them to ensure that they are protected. And so that's what I'm called to do, and will continue to do as well.
I appreciate your commitment. I really do. And we'll be backing you up on that one too. Thank you.
Thank you.
There's no stick like federal funding. Thank you for your time today. Are there any other board questions? I know we've got a pretty robust agenda for discussion in executive session. So if there are no more questions, I'd like to transition there.
Yeah, Sheriff, I just want to reiterate what Rafina said. I thank you for that statement that you made just a moment ago. There are too many people in our country today that are cowering as a result of the changes that have occurred over the past couple of months, and the fact that you are steadfast and others here are steadfast in their beliefs, and showing the type of courage that we want in our leaders is much appreciated.
Thank you, Stephanie. I appreciate that.
Interesting times ahead. All right, Sheriff, thank you so much for your time today. And if I may have a motion to adjourn to executive session.
Daniel has his hand up.
We,
Go ahead.
The minutes.
Oh, the minutes.
okay,
Thank you.
We postponed the minutes.
Okay, great. Go ahead, Sheriff. We'll see you again soon.
Yeah.
And if I may have a motion to approve the minutes.
So
Let's do
moved.
that. And then thank you.
Second.
All in favor, aye.
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 Opposed? Okay, great. Motion passes. And then may I have a motion to adjourn to executive session to discuss ongoing matters of deliberative privilege.
Second.
So
All in favor, aye.
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 Over there. Thank you.
Uh,
Have
Invite
Karen, were you saying something?
Yeah, I just asked if Daniel could send me an invite.
Oh,
Will do.
we'd like you there, Karen, so hopefully we can get you. All right, see everyone over there. Thank you.